Neil Fong. I'm the President of the Australasian College of Health Service Management. We're pleased to bring you another tips for leaders and encouragement in the COVID-19 pandemic. Our speaker today is Learne Durrington. Learne is the CEO of the West Australian Primary Health Alliance, which is the one and only primary health care network in Western Australia. It covers the whole of our state, metro and country, and Learne has been leading this organisation since its inception. She's a fellow of our college and she is a great person to have in Western Australia, and we look forward to her speaking to us today in these tips for leaders for ACHSM.
I'm Learne Durrington and I'm the CEO of the WA Primary Health Alliance, and I'm really delighted to talk about leadership during such an interesting time that we're all experiencing. I guess importantly for me, one of the first tenets of leadership in this environment is unusually we're all participants in this pandemic, as well as seeking to provide support and enable others. That's very unusual. In most disasters, we're not participants as well. And why is that important? Because it helps recognise that everybody is trying to cope and respond in their own unique way. And I say that given that one of our roles is supporting general practice, and GPs are as fearful personally and for their staff and for their practice as other people in the community. So here they are on the front foot, but also very worried about infection control, but also how do they best serve their patients. So primary care, as people would be aware, is a disparate group of small businesses. It's not a single system where in a disaster you can have a command control environment. And so it's quite unique in the way that we need to both communicate and engage. So we've worked, I think, doggedly, but very collaboratively with others. I think that's the other point, that while a disaster is a command control, it requires connections and collaboration, and that adage of no one entity can do it all. And while we've witnessed great leadership through the both state government and the Commonwealth governments, we've also witnessed great leadership of people in the front line. So leadership has come right through the whole system and across the whole system, whether it's the GP being very innovative about drive-through flu clinics, so safe for the patient, safe for the clinicians, but very targeted to ensure that all of their higher risk patients got a flu injection. So it's happened right there through to chief medical officers and the like. So our strategies, and I think again, importantly in a pandemic, have ebbed and flowed with the nature of the crisis. So where we were only 6 or 7 weeks ago is a very different place to where we are today, and particularly in WA, where we've had 8 days up until today, without a positive COVID response for an individual. So what are the takeaway messages? I think communication, as we all know, is key. You can't communicate enough. But what becomes important in this environment is single source of truth. How do we get to a disparate group of providers such as general practice or indeed allied health, factual, trustworthy, clear, streamlined messages, but also being very cognizant of the issues that they're struggling with. So communication is key. I think the other thing that sort of seems to pop up is advocacy. And why do I say that? Sometimes in a disaster context, decisions can be made that actually have an unintended consequence. So, on one hand, you're doing absolutely what you can to, in this case, ensure that we preserve the system of primary care to be able to respond. But conversely, decisions can be made that might affect the preservation of that system. So it's being alert to unintended consequences, all again done in best endeavours. So I think collaboration is key with all levels, vertically and horizontally, and be mindful of the consequences of both behaviours, communication styles, and unintended consequences, as I've said. I think the other thing is sometimes people like me have to just get out of the way. What I've witnessed in the last 6 weeks is staff joining together across silos, collaborating incredibly well to execute a strategy in an agile, flexible, responsive manner. And I guess the takeaway for me in that one was all of my staff want to make a difference too. It's not only the organisation or individuals such as myself, and we've got to enable that to happen. I think ultimately though, key messages are, this is a great time to learn. This is a great time to reflect. A great time to give thanks for the experiences that we're having with others, and to share this whole experience, not only with the health system, but our communities. And I think it's forced us all to stop and to listen and to take a few breaths and to take a bit of time. So really, I think it's this very personal growth as well as the growth of others when we're mindful around the impacts both personally and professionally.